Hi, and thank you for allowing us this opportunity to bring to you this presentation regarding diversity and cultural competence, which has been prepared for the Methodist Hospital in Houston, Texas. My name is Ariel Duran, and I am the Practice Administrator at Murdoch Pediatric Services in Cleveland, Texas. This presentation is a collaborative effort by a diversity-inclusive team comprised of current MBA candidates with focus in healthcare leadership management from West Texas A&M University. Their respective titles and affiliations are listed below. Let us continue by sharing with you this quote from ex-President Jimmy Carter, which relates very much to our presentation. We become not a melting pot, but a beautiful mosaic. Different people, different beliefs, different yearnings, different hopes, and different dreams. Let us go. Diversity and cultural competency in healthcare. The goal of this presentation is to provide greater insight on the following topics: U.S. Census expected changes in demographic trends, the need for more diversity, inclusiveness, and cultural competency in the healthcare workforce, closing the gap in healthcare disparities, and improving the quality of healthcare for all, improving interactions with a diverse patient population, and integrating a diverse population perspective. U.S. Census demographic change projections. By 2043, minority populations will become the majority in the U.S., comprising of 57% of the population, up from 37% today. Non-Hispanic whites will remain the single largest population. By 2060, however, nearly 1 in 3 Americans will be Hispanic, more than double from currently to 128.8 million. African Americans will increase to 61.8 million, representing 14.7% of the population. And Asian American will double to 34.4 million, representing 8.2%. Aging population, 65 and over, will double to 92 million. Our current healthcare system is in desperate need of diversity, inclusiveness, and cultural competency. It needs to be able to increase the racial, ethnic, gender, and generational diversity of healthcare leadership, which is essential for the provision of culturally competent, value-based care, and for this population to reflect the population they serve. They need to recruit and retain a diverse management team, which is a competitive advantage. Leadership has to be keenly tuned into seeing the world from different perspectives. Also, valuing the differences in others is going to elevate our ability to meet the expectations of our customers. Healthcare systems need to be able to provide care to patients with diverse values, beliefs, and behaviors, including the tailoring of delivery to meet patients' social, cultural, and linguistic needs. We need to be able to close the gap in healthcare disparities. This can be accomplished by leveling the landscape, by improving equality through more accessibility, timeliness, and quality outcomes. Also by creating more value, by implementing an interdisciplinary or transdisciplinary approach, developing more comprehensive strategies with a holistic perspective, and reducing barriers in care, while executing greater collaboration between primary care providers and specialists. Improving interaction with a diverse patient population. This can be accomplished through partnership building. Providers need to be able to change their autonomous and hierarchical behavior to become more of a partner in care, with more flexibility, self-awareness, empathy, and focus on treating others with respect and dignity. Also, removing providers' biases by recognizing the importance of social and cultural influences on patients, considering how these factors interact, and devising interventions that take these issues into account. Also, more research-based education and skill-building training to understand and effectively interact and communicate with multicultural patient population and colleagues. Another challenge that we're facing is how to integrate a diverse population perspective, which is important. We need to bring members of the community to the table to help guide the organization as it continues to assess and update policies and practices. Also, embedding diversity and the benefits of diversity across the multiple disciplinary departments, and segments within healthcare institutions. The model of healthcare delivery needs to be transformed into a patient-centered approach. Now that we have highlighted these topics, we are going to continue by covering them in more detail. My colleague Amy is going to take over the presentation from this point on and provide you with competence training information.
Hi class, my name is Amy Clapsey, and today I'll be discussing cultural competence and diversity in the healthcare environment. This section is dedicated to cultural competency and diversity in the healthcare environment, training information for treating and managing cultural and diverse populations for physicians, nurses, and leadership staff at the Methodist Hospital in Houston, Texas. The staff at Methodist Hospital primarily treats a traditionally underserved population with a diversity profile of approximately 37% Hispanic patients, 25% Black patients, 5% Asian patients, 30% white patients, and roughly 3% of other undefined races. The purpose of training is to provide recommendations for training staff in treating and managing culturally diverse populations in the healthcare environment. Because all people are influenced by cultural programming such as values, beliefs, morals, and customs, most have likely acquired patterns of ideas and behaviors that could potentially harbor attitudes or beliefs about groups under their care. For example, stereotypic views such as Asians are stoic or Latinos are emotional can harm our patient-provider relationships by blocking communication. Another example of destructive cultural incompetence is cultural incapacity. This is a belief of supremacy of one group, which can lead to ineffective medical practice due to a paternal or maternal posture towards minorities. However, the goal for all providers is to become culturally proficient in a multicultural society, such as the patient demographic of Methodist Hospital in Houston, Texas. A truly culturally competent individual has a heightened awareness and appreciation for patients' differences in self-disclosing, in interacting in the provider-patient relationship, and in perceptions of illness and risks of disease. Training strategies are often underutilized even though they are fairly simple and straightforward. Training strategies include teaching to understand cultural programming, teaching to acknowledge differences, teaching to institutionalize cultural knowledge, as well as teaching to value diversity. Providing culturally appropriate education and self-awareness training to the physicians, nurses, and leadership staff will aid in improving care and eliminating health disparities while providing high-quality patient care. Training activities such as cultural competence self-assessments are wonderful tools to help individuals explore the communication boundaries and barriers of others while opening the door to cultural uniqueness. Cultural competence self-assessments include questions such as, do I ensure that printed information is disseminated to take into account the average literacy levels of individuals and families receiving services by my healthcare organization? Do I display pictures, posters, artwork, and other decor that reflect the cultures and ethnic backgrounds of my clients and patients? Do I understand that it may be necessary to use alternatives to written communications for some individuals and families? And do I avoid imposing values that may conflict or be inconsistent with those of cultures or ethnic groups other than my own? Other resources include self-test videos, and the University of Georgetown offers a myriad of resources for the working individual as well as patients and general allied health staff.
Hello, this is Gail Babasi, and we'd like to continue with the training on the cultural competence for Methodist Hospital. This work has been started by Wilson back in 1982, describing the attributes for cultural competence that involve three major categories: personal, knowledge, and skills, with the personal categories focusing on items like the capacity for flexible response. In other words, the provider will need to have the capacity to provide flexible responses to several scenarios. It also includes the acceptance of differences between people, willingness to work with different minority groups. It also includes the articulation of people's personal values, stereotypes and biases, communicating our commitment to change racism and prejudice, and last but not least, the resolution of one's feelings about professional image versus systematic exclusion. As an example, certain professions that have a specific gender majority over the other gender. The other category includes the knowledge, and that refers to the knowledge of culture, which includes history, tradition, values, and these kind of things, and the impact of class and ethnicity on the patient's behavior. It also includes the help-seeking behavior of patients and understanding what that behavior looks like. It also includes the role of language and speech pattern in patient-provider communications. It's also very important to understand the impact of the social services on patients and families and how these can be utilized. This leads us to the patient's own resources that we can utilize as healthcare providers, such as agencies or networks and other resources that are very helpful in providing effective healthcare. The areas where professional values may conflict with ethnic minority needs also to be addressed very carefully, as well as the socioeconomic factors and the impact of these factors on ethnic minorities as well. The skills portion of the attributes include the skills for learning the specific culture in question and also communicating accurate information that refers and that relates to that specific culture. It also includes responding to culturally based cues and be cognizant of these. Assessing the meaning that ethnicity has for patients becomes very important in this case. And also, a provider will need to be skilled at identifying the stress and conflict that may be different between cultures in terms of representation. Interviewing techniques are important in these kind of scenarios, and also understanding the concepts of empowerment on behalf of ethnic minorities is also important. It's also vital in this case to be able to use resources on behalf of patients who otherwise may not be able to, and also recognizing the racism and stereotypes as a skill becomes very vital for a healthcare provider, as well as evaluating the perception of minorities for new techniques and research. The other piece on training for the cultural competence is regarding the cultural interaction. And we'd like to give some examples on the patient's perspective on cultural reference versus the providers. A patient may have a formal perception in general for healthcare versus the provider's informal method of communication. A patient may actually express their kindness and love through embraces, kisses, and handshakes, versus a cultural background for the provider that includes only handshakes. A patient cultural reference may include a hierarchical or gender inequality versus an equalitarian perspective for the provider. A patient may focus on extended family, and we see this a lot in minorities, versus more individualistic approach by the provider's cultural background. And also a patient may be implicit and indirect in terms of their medical information communication compared to a provider's direct communication in the explicit methods. And last but not least, a patient may value the time as prompt and important in terms of treatment timings, versus a provider whose experience may dictate that time might be relative. Let's now watch a short video and then follow that by some Q&A regarding some cultural differences and interests for minorities and diverse populations.
I'm Albanian.
I am Chinese.
I am deaf.
I am Punjabi.
My diversity is a strength, not an obstacle.
I want to be treated with respect.
With respect.
I want you to acknowledge my belief and customs,
even if you don't understand them. I want to feel I have been heard and understood.
I want to understand what I'm being told and not be made to feel small if I don't understand.
I want to feel safe.
English is not my first language, so when you're talking about my health,
please don't use medical jargon.
Make sure I understand your instructions. A misunderstanding over a dosage could be fatal.
Don't forget to ask me about the quality of your care. My feedback is valuable.
If I have a complaint, I want to have somewhere to go where I will be heard and understood.
I want to see my culture represented in your organization.
I want to feel safe.
When I come to you, I am sick or hurt. I might even be afraid.
I am at my most vulnerable.
Being understood.
Understanding you.
Being treated with respect.
Being made to feel comfortable.
Being accepted as I am.
As I am.
These things instill confidence.
Make me feel safe.
Okay, so after watching this video, I'd like to follow it with some questions and answers. And the first question I'd like to indicate here is, what seems to matter the most to patients? And you may have noticed that it looks like what matters actually the most to patients were respect, safety, and self-acceptance. People do like to feel respected, safe, and also being accepted for whoever they are. The second question I'd like to pose here is, what level of sophistication is desired when communicating medical information to patients? And the answer would be, we'd like to have basic communication with no medical jargons. People don't like to have complicated language being involved in these communications, as it also makes the understanding for these patients more difficult when compared to just the basic or lay-term language. And the last question I'd like to pose here is, how do patients value the importance of their feedback? You probably also noticed that the answer to this question becomes that patients are like to be heard in general when it comes to issues regarding their healthcare, and also they like to find accessible venues when they need to complain. So with that, I conclude my session, and now I'm going to move to Lakendra, who is going to walk you through the recommendations that we have for Methodist Hospital.
Hi, my name is Lakendra Blue, and I will talk to you today about recommendations on cultural competence and diversity in the healthcare environment. I will talk about the evaluation of the webinar. First, I will speak on the strengths. The data provided, it is thorough and aligns with our textbook. Includes a training video, and the selected topic is very valuable for current healthcare arena. A weakness I could find was it does not provide or give current data statistics on the outcome success of this webinar, and no follow-up was done. Recommendations. First, you must have professional training. Cross-cultural training must be a required integrated component of the training and professional development of healthcare providers at all levels. Organizational cultural competence should focus on promoting minorities into positions of leadership in healthcare and recruiting minorities into the health professions. Systemic cultural competence should focus on eliminating systemic or institutional barriers to care and improving the healthcare system ability to monitor and improve the quality of care. Clinical cultural competence should enhance health professionals' awareness of cultural issues and health beliefs while providing methods to elicit, negotiate, and manage this information once it is obtained. Now we have additional recommendations recommendations at the organizational level that will be sure to make your cultural competency successful. Okay, as a leader in Houston healthcare, what can you do? First, you must provide on-site interpreters, okay, for your patients who have limited English proficiency. Key health information should reflect the appropriate level of health literacy, language proficiency, and cultural norms for the population served. Now, this is important. It should include signage, specific programs for health promotion and disease prevention, health education materials, pre and post procedure instructions, informed consent forms, and advanced directives, amongst other material. You should implement quality improvement efforts to include culturally and linguistically appropriate patient survey methods, as well as process and outcome measures that reflect the needs of the multicultural and minority populations. Last but not least, programs should be developed to help patients navigate the healthcare system and become a more active partner in the clinical encounter. That way the patient, they feel more involved in their care, and they also understand what is happening and also going on at all levels of their stay and care.
Hi, my name is Tammy Gaden. Let's take a few minutes to wrap up and review the training webinar. Ariel began our presentation providing us with some of the needs that are present in the current healthcare system and why diversity and inclusiveness and cultural competency is important. We talked about the U.S. Census projections for over the next 30 to 45 years and how they will become more largely diverse among racial and age populations, and how the healthcare systems need to have a diverse leadership and management team, and the ability to provide care to a diverse patient population. And we need to improve equality through more accessibility, timeliness, and quality outcomes. We also need to improve patient-provider communication by partnership building and removing provider biases and more research-based education and skill training. The healthcare system also needs to involve the community. We need to embed diversity and the benefits of diversity across the organization. There's also a need to transform the healthcare delivery system to a patient-centered approach. We then focused on training strategies. Amy introduced some key concepts of cultural competence and some strategies that training should include teaching to understand cultural programming, acknowledge differences, institutionalize cultural knowledge, and value diversity. She also referred us to some links that training activities that can be used, such as self-assessment, videos, and tests. Gayla talked about cultural competence attributes that were developed by Wilson in detail and went over the three categories: personal, knowledge, and skills. We also talked about cultural interaction analysis between the patient and providers' cultural reference. Example, one might be formal and one might be informal. We watched a powerful video and had a Q&A regarding the patient's perspective on provider communication. Lastly, Lakendra provided us with some recommendations. One of the key recommendations being professional training at all levels in the organization. Having cultural competence at the organizational, systematic, and clinical levels. Providing on-site interpreters. Ensuring that your health information is appropriate regarding health literacy, language proficiency, cultural norms of the population served. Implementing quality improvement efforts for patient survey methods and process and outcome measures for the populations. And developing programs to help patients navigate the healthcare system. Let's conclude our webinar with a quote from Enrique Garcia Bayer. Diversity is anything that's different. It goes beyond race and ethnicity to different ways of thinking, doing, and behaving. We take an approach that enables people to understand, respect, and appreciate differences. When they do this, they are able to work with other people on their terms, and other people are able to work with them. On behalf of our team, we would like to thank you for participating in our webinar. We hope that you have found this information valuable and useful to implement in your organization at the Methodist Hospital. Thank you.